can aspirin help for depression? So aspirin is a pain reliever, anti-inflammatory. It's a very popular medication that's sold over the counter. It's high dose and low dose uses are quite different. But the question, can it also help with depression? So let's take a look at some of the research and let's figure this out. What is aspirin? So aspirin is acetylsalicylic acid, and it can relieve pain, it can reduce fever, it can lower inflammation. It works with cyclooxygenases, which are these products of inflammation. It just lowers all of them. So first of all, we know that inflammation is connected to depression. And there's actually like tons of research about this. So anything that significantly lowers that inflammation potentially will have a beneficial effect for depression. Not all types of depression involve inflammation, but definitely there's an inflammatory subtype, and a lot of different types of depression involve inflammation. So research shows that people with depression in general have elevated cytokines, so elevated inflammatory markers, some of them very elevated and some slightly elevated. So also aspirin might be, or anything like that, an anti-inflammatory might be particularly useful for the people with very high inflammatory markers with a lot of inflammation. So there's a bit of research. There's a research study from JAMA Psychiatry, which is like a really good journal. And that study looked at the use of anti-inflammatory agents, not only aspirin and a bunch of other things. And the study basically showed that anti-inflammatory agents do have promise in reducing depressive symptoms, especially for people with those elevated inflammatory markers. So, good, like reputable journal is making that connection. So that's one idea for why this might be useful. We also have research looking at the combination of antidepressants, so standard treatment for depression, and aspirin. So there's a study in psychiatry research that looked at this, and the results were good, were promising. Basically, adding aspirin to an antidepressant enhanced the effectiveness of the antidepressant. So people got better more quickly, had a bigger reduction in symptoms, especially people who had a lot of inflammation again. So that's, this preliminary research, that's what we know. The thing is that it's not so simple, because aspirin is not like a benign herb. It's a medication and it's an NSAID. And all these medications have side effects, and aspirin can damage GI mucosa, especially with prolonged or high dose use. It can damage the stomach, it can damage the duodenum, right? So parts of the intestines. And that damage is mediated by the changes that happen in the bacteria in the gut. There's even a study out there for using probiotic, Bifidobacterium breve, as an antidote to that damage to the small intestine caused by aspirin. And the probiotic, mitigated, it lowered some of the damage, but didn't completely prevent the damage. So because of that risk of damage to intestinal lining and a negative impact on the microbiome, I do not recommend aspirin as like an add-on treatment for everyone, even though there are some studies out there that suggest like, oh, it's helpful, it's effective. We have so many other anti-inflammatory, more natural treatments that do not damage your microbiome and do not damage your intestinal lining. That's lifestyle, anti-inflammatory diet, herbs, spices, fish oil, turmeric, right? We have a long list of options for how to target inflammation without using medications, and we can avoid these gastrointestinal issues. Also, for some people, there's a risk of bleeding, right? So aspirin is not like a benign thing, like a vitamin to take. It's a real medication, right? So also, absolutely, you would need to talk to your clinician or doctor, whoever you're working with, when considering adding aspirin. It should not be something that like you add and don't disclose, because aspirin could affect all kinds of other medications and bleeding rates. So make sure you run it by a clinician, but also consider like, is this really the best option? And if you do use it, ideally it would be like for a period of time, and then over time switching to more natural ways to reduce inflammation and treat depression in like a comprehensive way. It's not just like taking one thing solves depression. Depression is big, involves many aspects of life, right? So there should be like a comprehensive treatment plan, potentially therapy, potential changes in daily life and lifestyle, potentially even medications, right? And any one thing is just one piece of the puzzle.